When the Ebola virus disease came calling on these shores in 2014, it was decisively stopped on its tracks by the sheer bravery, amazing sense of patriotism, and fierce dedication demonstrated by a team of doctors and nurses at First Consultants, a private hospital here in Lagos, led by the now late Dr. Ameyo Stella Adadevoh. It was an unprecedented sacrifice which saved the nation from a tragedy of astounding dimensions. Rather unfortunately, that tragedy ended up playing out somewhere else. But today, Nigeria is once again having to deal with the impact of yet another contagion. Are there lessons to be learned from the way the Ebola experience was managed? What does it mean for it to set up this health trust in honor of those heroes who lost their lives on the line of duty? For a conversation around all of this and other subjects, we are now being joined by Niniola Williams, Managing Director, Dr. Ameyo Stella Adadevoh Health Trust. Welcome to the program, Niniola Williams. Good morning.
Welcome to the program.
Thank you. Good morning.
Good morning. Thank you for joining us. Well, before we begin to go into an examination of the various issues, first let's start with the Dr. Ameyo Stella Adadevoh Health Trust, also known as DRASA. When was it set up? How did it start? And what does your health trust, what does it do? And what is it doing currently in the context of COVID-19?
Thank you. Yeah, we started in 2015, and our goal was essentially that after Ebola, how do we ensure that Nigeria is better prepared for what may come next? We anticipated a time like this. We know that we very easily could have reached this level in 2014 with Ebola, but thankfully, because of the sacrifice of my aunt, her team, and the support of the government, we didn't. So our focus is really around issues of health and hygiene, preparing the health sector, and training doctors and nurses and all those who work in the health sector to ensure that they can do what she and her team did: identify an infectious patient, contain the person, treat the person, and also not infect themselves in the process. And so most of our programs are around that. We've been building capacity within the health sector, training both clinical and non-clinical staff that work in health across the country for the last 3 years. And most recently, we're part of the Lagos State response team for COVID.
That's great to hear, and it's great to see all of these efforts coming into fruition. And I mean, it's been 6 years now since the Ebola crisis hit, and rest in peace to Dr. Ameyo Stella Adadevoh, who gave her life to save this country. Now, based on what we experienced with Ebola, I really want to know how you would describe Nigeria's response to the outbreak of COVID-19 in the country so far. Do you think that we've done enough? Do you think that our efforts are adequate?
Yeah, I think Nigeria has done a fantastic job. COVID is a very difficult disease. It's not like Ebola in the way that it spreads. And you can just look around the world to see how difficult it is to contain this. However, because we have some experience, with polio, we were able to build capacity to deal with Ebola. And then with Ebola and all the other things we've dealt with since, from Lassa fever, meningitis, monkeypox, yellow fever, we've built more capacity to deal with COVID. Our response is not perfect, but there's no country in the world that has had a perfect response. The government has done a very good job.
Well, when you say government has done a very good job, I would like to know whether DRASA is involved at any level, whether state or federal government, in this war against COVID-19. And if indeed your health trust is involved, what are the points of intervention? What have you been doing?
Sure, yeah, we're very much involved hand in hand with government, as are many private and other public sector organizations. I think this is a time when we're really seeing Nigeria come together as one to fight this thing. And in terms of DRASA, specifically, we're supporting Lagos State because that's the epicenter of the outbreak now. And what we've been focusing on is building capacity. We know that there are many private sector partners that have put money towards and resources towards building treatment centers, bringing in equipment, buying protective gear, all of those things, which are very important. But where we're filling a gap is looking at what I like to call the software of the response, which is the human capacity. Because you can build all the centers you like, you can bring in all the equipment, but if you don't have the human resource to be there on ground, serving and treating patients in those places and knowing how to do it safely, you have a problem. So we have been training. We've trained over 1,000 health workers so far, from doctors and nurses to ambulance drivers who are evacuating patients from the communities to those working in the lab. Everybody involved in some level of the response needs some kind of training on infection prevention and control. And that's what we've been doing.
That is absolutely right, and it's gladdening, to hear that these efforts are actually being put into place. And it's interesting as well because this morning on the news we were speaking about the fact that unfortunately 40 health workers so far have lost their lives to COVID-19. Now, your organization DRASA is training thousands, or about 1,000 so far, health workers in different capacities with regards to, I guess, identity containing and treating, because that's what you brought up. So can you tell us more information or shed more light on how you feel the response is going? Because it's a bit worrying to see that we're losing quite a lot of health workers here. Or do you think that the numbers are actually, you know what, what's your take?
No, I mean, it's correct. It's very worrying because we know that Nigeria, we already have a shortage of health workers, so we can't afford to lose them at a crucial emergency time like this. And that's exactly the reason why we set up DRASA, this health trust, is to build capacity. And we've been trying to do that for the last 3 years, but you know, we're a small organization and our scale is small. We're looking, you know, for partners and resources to help us grow because it is an emergency situation and we can't conquer this thing if we don't have the human capacity to do so. So yes, we've trained 1,000, but you know, I would love to be able to come back, you know, in a short amount of time and say we've trained 100,000. Because we need to get to that scale if we're going to be able to tackle this thing. Health workers are doing their duty, they're on the front lines, and some of them are losing their lives in the process, which is a very unfortunate thing. And so we need to ensure that infection prevention and control is something that we prioritize in the country and that we build their capacity to do their work safely and with confidence so that they can treat patients and everyone can be safe.
Well, you just talked about infection prevention and control. And clearly there are persons who hold the view that there are very serious gaps in this regard. Now, how big is that gap at various levels from primary health care to the tertiary level in Nigeria?
Yeah, unfortunately, it's quite big. And again, that's the gap we're trying to address, because if people at different levels can't identify and contain these threats, we have a situation like what we're seeing around the world now, which is a pandemic. And these challenges are not unique to Nigeria. Every country has challenges in infection prevention and control. It's not something that you know, people are learning in school or in medical school, nursing school. You know, you become a cleaner in a hospital, they don't teach you about how to protect yourself in the process. We've had cases of people picking infections from the hospital and taking it home to their communities. And then we have a small outbreak somewhere. So these are things that, unfortunately, we're trying to quickly fix in an emergency situation, but really for sustainability, this needs to become part of the way we operate in the health sector and also in other sectors.
Certainly it does. Can you give us any key healthcare interventions that you think could help us to better operate in terms of infection prevention and control?
Yeah, I mean, the number one thing is training. And when I say training, it's not even just sitting down in a classroom and listening to lectures. It's the way we do our training, it's hands-on and it's simulation-based, because you can't anticipate how someone is going to react to a possible threat, like an infectious patient, until they're faced with that threat. And so a lot of what we do is simulating that kind of environment so that whether you're an ambulance driver, a sample collector working in a lab, a nurse, a hygienist, whatever your role is in the health sector, when you are then eventually one day faced with that threat, you know exactly what to do. And so we need to scale up this kind of capacity building nationwide.
Well, I mean, when you tell people about DRASA, I mean, they're likely to be, excited almost immediately because the Health Trust has a name recognition. They will say, oh, Dr. Ameyo, Stella, Adadevoh, that's the Ebola heroine. But I imagine that since you started, you must have faced quite a number of challenges, maybe perhaps hindrances. If this is true, what are those specific challenges that you have faced?
Our biggest challenge is just scaling and growing our operations. We know that we're filling a gap. We know that we're assisting government and working hand in hand to protect the Nigerian society. But what we really need is support, financial support, partners and corporate partners. So far, even during this response, we've gotten a lot of support from organizations like FAMFA and DLM Capital, but we're looking for more partners. We need people to come, hand in hand with us to fight this thing. If we don't do it together, we can't get there.
Certainly, it's a hand-in-hand approach that we have to take towards fighting this. And going forward, I'd also like to ask you how you feel we need to prepare for the next pandemic. And it seems a bit scary to speak about in the middle of an existing pandemic. But, I mean, I'm saying this because after the Ebola crisis, we were told that 7 quarantine centers were built across Nigeria in preparation for the next pandemic. But they were nowhere near ready as soon as we had the outbreak of coronavirus in Nigeria. So let's speak about the next, unfortunately, pandemic and how we need to prepare for that.
Yeah, it's a difficult thing when you're trying to get people to prepare for something that they can't see as an immediate threat. And that's the struggle we've had, between Ebola and now COVID, is trying to prepare the health sector and get people to invest in something that they don't really see the need for. But I believe that with COVID now, we're going to enter a new world once we get through this. And what we're looking at is how can we ensure that we indoctrinates and ingrain infection prevention and control in every aspect of Nigerian society. Yes, within the health sector, but there's so many other health sectors, or rather other sectors that need this kind of support as well, from banking to telecoms to restaurants and food industry to corporates as well. Anybody that has people gathered in public spaces that for any reason, there's a need to be trained and build your capacity in infection control. Because again, we're entering a new world, and unfortunately, we know that COVID-19 will not be the last one. There will still be more coming.
Well, I mean, many people will agree with you when you say that the Nigerian government is not doing badly, indeed. Yeah. But there has been a challenge in terms of the people following government guidelines with regard to COVID-19. Yeah. Some people willfully violate social distancing rules, the stay-at-home order. And you find in many parts of the country that perhaps it's either the people are not listening or they just don't care. Where do you think the problem lies? Is it lack of trust between the people and the government, or there is something else that the government needs to do in terms of communication? Now we're in the Ramadan season. Yeah. People are being advised to be careful, but in a few days, we may not see that evidence. People will say, no, this is our religion. It has nothing to do with COVID-19. What's your take? What do you think is really happening?
Yeah, it's very challenging. Even with the Ebola outbreak across West Africa, one of the reasons it spread so fast in the other countries was this issue of, at the community level, people not doing what government was telling them to do. It's a challenging thing because, we have cultural biases, we have religious beliefs, we have things that sort of override the science, if you will, of this public health emergency. So it's a very challenging thing, but again, it goes back to reorienting people's minds, and the way to do that is to educate them, build the information, help speak their language, talk to them in a way that they can understand and they can appreciate. But again, as you mentioned, trust is also another issue. So what we also like to do is use community leaders and advocates, people who are already respected and trusted in those places, to carry the message forward, because sometimes that top-down approach just doesn't work.
Absolutely, you're right. The orientation of people is key if we want to actually fight this pandemic. I wanted to ask you, people who do want to get involved with DRASA, who would like to contribute, volunteer, etc., are there avenues in which they can do that, and if so, how?
Yes, absolutely. We welcome all levels of partnership, and they can visit our website, www.drasatrust.org. That's DRASATRUST.org. And we'd be happy to connect. They can call us, send an email, drop a note on the website, and we'll get in touch.
Well, I mean, in the course of this COVID-19 experience, if I may put it like that, if it's an experience, it's quite a tough one for everybody around the world. We've been hearing all kinds of claims about and conspiracy theories. Some people say if you take alcohol, like Mike Sonko, the governor of Nairobi in Kenya. Some people say if you take hot water, or if you take turmeric and ginger, or you take neem leaves, that these are likely solutions. I mean, you are involved in the health sector. Do you see any merit to all these options, and particularly also whether holy water and anointing oil can make a difference in your interaction with many of the stakeholders involved? What kind of conversation is going on in this regard?
Yeah, I think definitely there's a place for faith and belief. I think that's something that we definitely agree with. However, in terms of the different interventions, from drinking hot water and all these things, what they do is they help with the symptoms of disease, but they don't kill the virus itself. Unfortunately, right now, being that this virus is, 4 months old, about that, we don't have a treatment yet, as you mentioned earlier in the program. And so those things are good for treating, the symptoms of sore throats, tiredness, and all those other things. But they don't kill the virus itself, which I think is the misconception that is going around. But again, we saw that during Ebola as well. And unfortunately, sometimes these misinformation end up causing people to harm themselves. We actually had one patient who had diabetes, and he drank a whole bottle of alcohol thinking he would be protecting himself from the coronavirus, and unfortunately he passed away as a result. So again, that's why information and education and training is so important, because when people don't know what to do, they often do the wrong thing thinking they're protecting themselves.
Certainly. Let's also speak about testing. This is something we covered at the start of the conversation today on the morning show, and particularly in terms of our capacity. Now, we've been told by the Presidential Task Force that we can test up to 1,500 COVID-19 tests a day in 13 labs across the country, which essentially is, I believe, 19,500 in capacity. Yet we were also told that what we're testing is 600 a day in the 13 labs, which is 7,800, but that is because that is what is being received. Now, in a state like Lagos, we've seen creative initiatives like the house-to-house search coming forward for us to find more ways to increase testing and increase our testing capacity. Do you see other ways in which we can increase testing capacity, or do you think it's justifiable for us to only keep our testing at 600 because that's what it is?
No, and I think, government is aware, and there are lots of efforts being done now to try and go into the communities and bring out more samples, because if you have more samples, the labs clearly have the capacity to test them. And so right now, one of the things Lagos State has just launched is sort of a decentralized sample collection process. So all the LGAs and 3 other centers as well. So now we have 23 centers and counting around Lagos State where people can go and get their samples collected. And I think making it easier for people to move around and get their samples taken will also help us increase the numbers.
Well, Africa has so far about 27,000 cases. And there are some analysts who are saying that, well, we're still quoting 27,000 confirmed cases because Africa is not doing enough to trace the disease and to test and to provide reliable statistics. And the fear is that we may get to a point where we'll have an explosion, the type that we have seen in Western Europe and also in the United States. Do you think that that is a possibility? Do you think African countries are taking COVID-19 for granted?
I can't say that we're taking it for granted. I know Nigeria is very concerned. We've seen, being that Africa is sort of the last frontier for this virus, we're just in the early stages of our epidemic compared to the rest of the world. We've had the luxury of watching other countries and seeing what they've gone through. And we know that we're not necessarily any different from them. So we're anticipating that likely we will have a surge in cases. But again, what that means for our society, we're not sure, because this virus manifests differently in different populations. It may be that the majority of Africans are asymptomatic or mild or moderate cases, as opposed to what we saw in Italy, for example, because we know the Italian population is much older, and so they had a lot more severe and critical cases. We're not expecting that for Nigeria because we're a more youthful country. So these are all the factors we have to consider, but it is a possibility that we will have a surge. And that's what we're bracing ourselves for now.
Certainly. I mean, our average age in Nigeria is between 18 and 19 years old. Yeah. So we're an extremely young country, which does give us hope during this pandemic. But let's also get your views on the lockdown situation. Now, the lockdown was initially for 2 weeks, and it was extended to 3 particular states, well, 2 states in the Federal Capital Territory, Lagos and Ogun. The Presidential Task Force and President Muhammadu Buhari went on to extend it for a further 2 weeks. And now state governors have also come together to also announce an interstate lockdown, which essentially is a proposal to the federal government to have a total nationwide lockdown. What are your views on the lockdown? Do you think that this is something we need to extend again? Do you think that this is the Nigerian solution to the Nigerian problem? Is it working for the people?
That's a very good question. And I don't envy those who are the decision makers in this process, because it's a very difficult thing to do. You have to weigh the benefits of a lockdown against the consequences of the lockdown. In a country like Nigeria, where we have, people who need to move to survive, need to move to eat, how do you justify locking them down to potentially save lives. It's a very difficult call to make. I don't know that lockdown is a sustainable way to battle this pandemic in our country, just because, again, the unintended consequences of the lockdown. We're already starting to see the social unrest. People are hungry. There's a lot of need, and we don't have systems and structures that were in place before to address those needs in a systematic way. And so I think that I can't say whether continuing it or not is the right decision, but we definitely, as you said, need to come up with something that works for our society, not just adopt what everyone else in the world is doing.
Well, I mean, still on infection prevention and control. We had Ebola, we survived that. Right now, we're dealing with COVID-19, but there's also Lassa fever.
Correct.
Do you think that the focus on COVID-19 is robbing us of the opportunity to pay more attention to other infectious diseases? WHO has said that we're likely to have about 70 million cases of malaria in Africa this year. Lassa fever, the figures for Lassa fever in Nigeria have been rising. So how do we make sure that the approach covers a whole range and not just one particular challenge?
Yeah, it's a difficult question as well because, you know, around the world, everyone is in firefighting mode. The fire is on ground and we need to put the fire out. And while the fire is burning, other things are happening that no one is paying attention to. We're seeing non-COVID deaths also on the rise because everyone is focused on COVID. And so, as you said, Lassa fever has been with us for 51 years. We've had Lassa fever outbreaks consistently for decades. And unfortunately, at a time like this, it's not getting the full attention. However, Nigeria CDC has set up a fantastic system to respond to Lassa fever outbreaks around the country. And they've been on ground in the affected states since before COVID. So there's that gives people some hope and some help. But definitely, it's a difficult call now because everyone wants to focus more on COVID and less on the other things. And so I know that there are some groups that are starting to look at those unintended consequences of focusing all our attention on COVID to the detriment of other infectious diseases and also other chronic conditions like diabetes and other things that people still need care for.
Certainly. And I mean, to be honest with you, we're coupled with a lot of things we're facing right now, and we do have to find a way to shift our focus in the right way or share our focus in the right way. But let's also speak about Kano State. Kano State has been a particular concern to the government and to the people over the past few days. In the space of 4 days, we heard of 180 deaths that couldn't really be accounted for. However, the people who lost their lives were said to have had symptoms of hypertension, diabetes, malaria. We even heard in some cases certain things that we already know have also been identified as similar symptoms to COVID-19. Now, the federal government have sent another 17-man task force over to Kano State, I believe, with 7 representatives from the WHO, and Dr. Hekweazu has also come out to reaffirm us that there is a treatment center with 300 beds in Kano State, but it doesn't take away from the peculiarity of the situation. What is your take on what is going on in Kano State right now?
I actually think that this is one of the unintended consequences of lack of capacity, human capacity, going back to this training issue again. You know, if you don't have people on ground who feel that they're ready to deal with coronavirus, you end up with this kind of situation where people, presenting with any symptoms may not get the kind of care they need. And subsequently in Kano, for example, some of them would have died. And so, again, it goes back to ensuring that we're building the capacity of the human beings who are going to receive these patients, whether they're COVID or non-COVID patients, to be able to care for them in the right way and while protecting themselves in the process. Because again, these health workers have a duty, but nobody wants to put themselves on the front lines and die. Everybody remembers what my aunt and her team suffered, and it's a difficult thing to do. It's to make that kind of sacrifice. And so the least we can do is build their capacity, prepare them, equip them, give them the tools they need before we send them out.
Well, DRASA seems to be doing a lot around Lagos and with the Lagos state government on COVID-19. Have you considered working in other states of the Federation, or you are hampered in that regard by resources? And where do you see DRASA and its operations in 10 years?
Yeah, we definitely support other states. From time to time, we travel out and go to other states in response to different things, from Lassa fever to other infectious disease outbreaks. However, resources are really our biggest constraint. What we're doing now is setting up a simulation training center here in Lagos State And our plan is to set up those centers in other states so that we can continuously build the capacity of the health workforce and others involved in preventing and controlling infections. And that's why we need the support to scale and get to that level where we can ensure that we're prepared, whether something starts in Bauchi, whether it starts in Kano, Rivers, wherever the first case comes up, it can be easily and quickly contained and everyone can be kept safe. So those are the things that we're working towards. And in terms of where do we see ourselves in the future, we envision a future where, a lady walks into a hospital or arrives at the airport and she's coughing, and she's greeted and taken aside by a highly skilled and trained professional who will ask her some important questions and then take her to a comfortable isolation space where she can be tested and treated and eventually healed and go home to her family. That is the future we see for Nigeria, but we do need support to get there.
Certainly, you do need support to get there, and we've spoken throughout the course of this conversation about the importance of, infection prevention and control, those three. And I wanted to ask you something. Is this something as DRASA as a body would like to see infused into school curricula at some level or another in the near future?
Yeah, 100%. And we've actually already started that. So again, simply just in Lagos State, working with the Ministry of Education, we've set up what we call health and hygiene clubs in senior secondary schools around the state. And the idea is that as part of their co-curricular activities, they can join, the debate club, the literature club. They can also join the DRASA health and hygiene club so that it's part of their education process and they can take that forward to wherever they end up next.
Well, we have just about 2 minutes to go or less, but I'd like to ask you, a lot of people have been talking about post-COVID-19 contest. They've been talking about exit strategies to deal with, challenges after COVID-19. Now, what do you think the world will look like after COVID-19, and how can we prepare for that future?
It's going to be a very different place. I was having a conversation the other day with some colleagues, and we were discussing the fact that certain industries may suffer a lot. For example, cruise ships. A lot of people are now afraid to go on a ship because of what we're seeing with all the various cruise ships around the world that have had their own mini outbreaks on board. And so I think a lot of industries are going to have to find ways to bring in technology to support their operations so that, reducing the face-to-face interaction as much as possible. Some industries may become defunct and, we may have to retool and repurpose certain jobs and industries to do other things. I think these are the things we're starting to see now, knowing that, again, COVID-19 is not going to be the last one. We hope that the next one will not go as far and kill as many people, but we know there will be more infectious diseases to come. So we have to start thinking about how to repurpose our entire society, not just the health sector, to deal with that.
Certainly, and it's particularly difficult when you think about certain societies that have cultures that encourage large gatherings. For example, here in Nigeria, when you think about it, how do we stop church services from happening? How do we stop people from going to mosque, and how do we digitize these things? It is proving to be quite hard, and it is going to be something that is going to be quite hard. Do you think we're going to be able to adjust to that new normal here in Nigeria?
It's going to be very difficult. Again, behavior change is a difficult thing. Trying to get people to remove and move away from what they used to do to a new way of doing things is hard. It's only a crisis of this magnitude that can really get us to even start having these conversations. So I think efforts will be made, but it's going to take time. It's going to take time.
Well, thank you very much, Niniola Williams,
Thank you.
for joining us this morning on The Morning Show. Thank you very much indeed.